everyone. There is a common confusion that if kidneys are weak, then how come urine output is still intact? So let us understand the process of urination. In each kidney, human beings have up to 1 million nephrons, which are the basic unit of filtration. And these nephrons are made up of a globular structure called glomerulus, followed by a tubular structure called renal tubule. Initial filtration takes place in glomerulus, where blood is cleared and initial filtrate, the initial urine, is formed in an amount which is as large as 180 liters per day. And this initial glomerular filtrate passes through the renal tubule, and during this passage the initial filtrate is processed in a manner that the final urine which comes out is exactly as per our needs and requirement. Few initial things which should not have been filtered and which have come out in glomerular filtrate are actually reabsorbed in the renal tubules, and few extra toxins which still needs to be excreted are excreted in the renal tubules, and while the urine is passing through the renal tubule, this is concentrated to the extent that initial 180 liters comes down to about 1.8 liters per day, and the final urine is as per our requirement, as per our ambient temperature, as per our water intake and so many other things. But imagine a situation when GFR, the glomerular filtration rate, has been reduced to 10%. Then if GFR reduces to 10%, then initial glomerular filtrate, which was 180 liters, will reduce to 18 liters, but this is still very high. Now, if the concentrating ability of renal tubule is also lost because of the kidney weakness, then this 18 liters of initial filtrate will not be concentrated properly, and it is possible to pass good amount of urine in spite of 10% of glomerular filtration rate. So it is possible that even if kidneys are weak, still patient is passing good amount of urine. So if the disease in kidney is glomerular in origin, such as chronic glomerulonephritis or diabetes, then there would be more of swelling and less of urine output. But if the disease is interstitial nephritis, which primarily affects renal tubule, such as chronic interstitial nephritis, such as polycystic kidney disease, such as kidney damage secondary to renal stones, then the urine concentrating ability is impaired, and it is possible that in spite of kidney failure or kidney weakness, patient is still passing good amount of urine. So in such patients, when the doctor tells them that your GFR is low, your creatinine is high, they are taken aback that this is not possible. But I just tried to explain that urine output alone doesn't indicate the GFR, doesn't indicate the percentage function of kidney function, and it is quite possible to have good amount of urine in spite of the fact that kidneys are not working that well. Thank you.